Welcome, everyone, to this year's final My IBD Learning virtual program, IBD and Your Emotional Health. My name is Eugene Lasansky. I've been an IBD support group facilitator with the Crohn's and Colitis Foundation since 2012. Currently serve on the Foundation's Patient Advisory Council and the 2024 Challenges in Research Patient Advisory Committee. And I've been a Crohn's patient myself for nearly 20 years. Each of this year's My IBD Learning virtual programs concerned a topic of how to achieve IBD remission. Prior to each program, the Foundation polls the community over social media to determine which topics in remission are most important to you. You chose, and we listened. Our last program of this year is focusing on emotional health. Taking care of your mental and emotional health is just as important as treating your physical symptoms. Tonight, you'll hear a brief overview of how stress and anxiety can have an impact on your IBD, as well as some coping strategies and tips for talking with your healthcare team about your emotional well-being. Throughout the program, we'll be posting a few brief polls on your screen to make this program more interactive. That first poll should be appearing on your screen right now. Let's find out who's joining us today. Once you make a selection, the window will close and the presentation continues. There'll be 3 brief poll questions asked during the program. Thank you for participating, and let's get started. The information shared is meant to be for educational purposes only and should not replace any advice or guidance from your own healthcare professional. This program will be recorded and posted on the My IBD Learning website, crohnscolitisfoundation.org/myibdlearning. Everyone who registered for this program will get a link with the recording next week. We want this to be as interactive and engaging for you, so we encourage you to submit questions through the Q&A box at the bottom of your screen. Following our expert discussion, I'll moderate a Q&A session with all of the panelists, and we'll try to get to as many questions as we can in the time allotted. Tonight's My IBD Learning webinar is graciously supported in part by a sponsorship from AbbVie. Additional support is provided through the Foundation's annual giving program and donors. On behalf of the Crohn's and Colitis Foundation, thank you all for joining. Our 2 expert presenters tonight are Dr. Megan Reel and Dr. Rachel Lawton. Dr. Megan Reel is an associate professor of medicine and director of GI behavioral health at the University of Michigan. Go Blue. Her research and clinical expertise have led to several peer-reviewed publications, book chapters, invited commentaries, and an upcoming book co-authored with Kate Scarlatta, Mind Your Gut, the science-based whole-body guide to living well with IBS. Dr. Reel participates on several committees within the Crohn's and Colitis Foundation. Dr. Rachel Lawton is a child psychologist and clinical assistant professor within the Division of Child and Adolescent Psychiatry and Child Development at Stanford University School of Medicine. Her clinical work and research have largely focused on providing evidence-based and family-centered care for patients and families experiencing childhood anxiety and trauma, including care for youths who are navigating chronic illness. Rachel has collaborated with the Foundation for nearly 2 decades, and as a patient diagnosed with Crohn's herself, is thrilled to have this opportunity to share meaningful conversations with colleagues, parents, and patients alike. We understand the importance of your questions, and we want to ensure that we answer as many of your questions as possible. Tonight, we have the honor of having Dr. Catherine Tomasino monitoring our Q&A box. Dr. Kate Tomasino is a GI psychologist and assistant professor of medicine and psychiatry at Northwestern University Feinberg School of Medicine, where she co-directs their GI psychology program. She's also a member of the Crohn's and Colitis Foundation's National Scientific Advisory Board Patient Education Committee. If you have a question for Kate, please type it into the Q&A box. She will do her best to answer as many questions as she can, keeping in mind she may not be able to address every question. Following the conversation with Megan and Rachel, Kate will join the group for a little live Q&A session. Here are our presenters' disclosures. Now let's get started with tonight's conversation on IBD and your emotional health. Dr. Reel, let's start at the very beginning, could you explain how our emotional health, things like feeling stressed, angry, or nervous, can play a role in the disease outcome?
Yeah, so thank you so much for having me, and I'm excited to be here with Dr. Lawson and Dr. Tomasino and you, Eugene. I love this topic because when we think about IBD management, a lot of the focus goes to medical management, getting the disease under control, hopefully into remission. And the reality is that your emotional health is just as important as your physical health. And there can be this bi-directional relationship between your anxiety, mood, symptoms of trauma that can be related to the disease. And then the disease can also perpetuate some of these symptoms. So when we see that anxiety or depression is untreated, it often can lead to higher hospitalization rates, higher healthcare utilization. We see more complications with surgeries. And so it really highlights the importance of addressing both the emotional and physical side of health management. And kind of backing up a little bit, maybe anxiety and depression or trauma are not necessarily things that you're struggling with on a day-to-day basis, but stress can play an important role, and also just situational things that can impact, maybe a slightly higher bump in anxiety or sadness. And so I encourage people to kind of think about, how am I doing? How am I actually feeling these days? And that can kind of guide maybe where some of your attention goes in terms of coping strategies or reaching out for support or resources. So I think it's a great way to open up the conversation in terms of anxiety, stress, mood can impact all of us. And certainly Dr. Lawson is going to talk about how these things can impact our pediatric population as well.
Thank you for that, Dr. Reel, and it's great to have you with us. Dr. Lawton, we know that children can be impacted as well, especially when it comes to that transition through childhood and the awful teenage years and into adulthood. Can you elaborate how the younger community's emotional health is impacted by IBD?
Yeah, absolutely. And I will completely echo Dr. Reel's thanks and gratitude for being a part of this. This is a topic that's near and dear to my own heart, so I'm excited to be able to collaborate. I think that the piece that comes to mind most is a comparison to sort of that medical model that kids aren't just sort of tiny adults. And when we think about their social and emotional well-being and the impact of IBD, there are some nuances to child and adolescent health that adults just don't experience. So the first one would be school. We've got kids that are actively managing a chronic health concern that may or may not impact things like fatigue, presence in class, needing to get up and go to the bathroom, hospitalizations, times to leave for infusions. And so I think one of our paramount goals is really trying to find ways to not only maximize a child's ability to access learning in a way that is compatible with disease management, but what are those other variables, just like Dr. Reel mentioned, anxiety, depression, symptoms of trauma, stress, that can complicate that learning process in ways that things like considering a 504 plan, accommodations in school can help to facilitate. I think the second piece that we often think about is IBD has a substantial impact on growth and development, particularly for our little guys. We know that growth delay in puberty, and just the general body image implications of IBD in general are things that our adults struggle with. And so place that in a 12-year-old in middle school who's a good 6 inches shorter than their peers, and maybe struggling with the consequences of steroids and whatnot, the growth piece and the body image piece, I think can be exacerbated when you already have a developmental time frame when kids are in a vulnerable place to begin with. And so and making sure that we're not only asking about it, but that the priorities when we're really conceptualizing treatment approaches take that into consideration. The third piece I would say is friendships and relationships, and that is equally applicable on the adult end as well.
Yeah.
I think sometimes the nuances and rules of adolescent friendships are a little bit different. But the facts remain the same. We want our kids to be able to, nurture relationships with peers that feel open and safe, and that they can confide and share some of these things with them. For all of these three specific topics, the piece that comes to mind most for me is we really want to help empower our kids to be comfortable with their own health and with their own diagnosis, which will let them advocate in each of those settings, right? We want them to be able to lean on the people who are advocating for them, but like more than that, we want them to be able to advocate for themselves.
Thanks, Dr. Lawton. That's some great insights. So if an individual is experiencing some challenges in their emotional health or daily life, there are a variety of approaches and therapies that a mental health professional could help with. Can you talk about some ways you might be able to gauge your own needs?
So I think that a lot of times it's a spectrum, right? And recognizing that IBD is a relapsing and remitting disease. Where you're at 1 month might look very different from how things look a couple months later, from both a physical health perspective and your emotional health. And we also know that there are a lot of symptoms that are invisible with IBD: fatigue, vitamin deficiencies, nutrition deficiencies, difficulties with sleeping. And some of these symptoms overlap with mood symptoms. So, fatigue and difficulties sleeping, feeling like your concentration is a little bit off, brain fog, those could be related to something with your physical health, and they could also be symptoms of depression. And I think that keeping a pulse on how things are going from a lifestyle perspective, and how your sleep hygiene is. How do you feel capable of exercising? How is your appetite? And do you feel like you can plan meals, or are you hungry? Are you staying connected with friends and family? Those are all kind of self-care things, but they can be a marker of whether something in your health needs some extra attention. And so if you're finding that you're not sleeping as well, you're a bit more avoidant of things, I would encourage you to talk with your medical provider. If that is something you can do first, that way we can run labs. We can talk about, are there any other psychosocial stressors that might be contributing to some of these symptoms that you're experiencing? And if labs all kind of check out, and as you're talking about things that are going on in your life, it might help lean you toward, well, let's maybe do some assessment of, can we manage some of this on your own, or do you feel like you might want some support with a mental health provider? So as you're thinking about, how you even asking yourself, is my stress high? Is it low? And just having IBD presents you with a lot of different stressors that you're navigating on a day-to-day basis that can contribute to that mental load, that carrying of a lot of things that can impact how we feel emotionally and physically. If the mental load is getting higher and higher, and you feel like you're having a bit more difficulty with managing it all, that's where a couple sessions with a general mental health provider to kind of draw up a treatment plan and what that looks like can be beneficial. So I think just kind of recognizing and accepting, destigmatizing that mental health and stress management and self-care is all a part of your holistic treatment plan, that might help get you the services and the resources that you need sooner rather than later.
Thanks for that, Dr. Rio. For Dr. Lawton, what are some of the evidence-based psychological therapies that are available, and are they available for both adult and pediatric patients?
Yeah, absolutely. There's a range of different therapeutic approaches that have a really strong evidence base and that have been adapted to both child and adolescent and adult framework. The gold standard across the board when we're talking about treatment for anxiety and depression, particularly within the context of chronic health concerns, would be cognitive and behavioral therapy, or CBT. CBT is based on the premise that our thoughts impact our feelings, and that impacts our body and our behavior. By addressing and increasing our awareness in changing one of those different pieces, we're able to shift that cycle. Acceptance and commitment therapy, consider it sort of the grandchild of CBT. It's newer, but also has a really solid evidence base, and is much more focused on recognizing that there are experiences and emotions that we can't necessarily change, and instead identifying ways to let our values guide our behaviors rather than our affect or our emotions. And so it turns out that when we use our values to guide our behavior, not only does our affect improve and our emotional status typically improve, but we're also able to engage in the behaviors that are meaningful to us in a more comprehensive way. Dialectical and behavioral therapy, or DBT, is a therapeutic approach that also has a strong evidence base and is typically a recommendation that we lean into when we've got a child or adolescent or adult who may be struggling with more intense emotions, or maybe struggling with figuring out how to manage those intense emotions. And then trauma-focused CBT, that's actually a pediatric child and adolescent intervention that's designed to take the critical components of CBT and apply them to the context of a child or adolescent who's experienced any kind of traumatic event or sequential traumatic events. And there are corresponding therapeutic approaches for the adult patient population as well. Each of those has a strong evidence base, and we would want patients to consider participation in one of these modalities if they were presenting with symptoms of depression or anxiety that were consistently impacting their functioning across the board. Supportive therapy, having someone listen and give you validation and support is wonderful. And at the same time, we know that these therapeutic approaches that are a little bit more structured and that have decades of research in some instances are the way to go.
Excellent information, Dr. Lawton. Much appreciated. I know that sometimes medications are used to help people cope with IBS. Dr. Reel, would a patient ever be prescribed medication to help cope with IBD-related depression or anxiety?
Well, so this is an interesting area where anti-anxiety and antidepressant medications are commonly used in GI to even offset some of the GI symptoms that a patient may have. So we call them neuromodulators, and they can work to help. Sometimes we use the side effect profile. So some of these neuromodulators can actually speed up motility. So for somebody that's experiencing constipation, your doctor may prescribe something in that category. Some can help slow it down. We also use neuromodulators at times for pain management. And so for patients that have GI conditions, especially IBS, these are commonly considered for some patients that we think that it would be effective. We're oftentimes dosing these medications much lower than we would therapeutically if we were treating anxiety or depression. And so in the same way that we would for a patient with IBS, we may consider some of these medications for a patient with IBD that has overlapping IBS type symptoms, or again, for a pain management support. So it's important to talk with your doctor about all of your symptoms, because if you're not already taking a medication to help with mood symptoms and you happen to also be having anxiety or depression, sometimes you can get more bang for your buck out of the medication by dosing appropriately. But this is something that your gastroenterologist may be open to recommending and prescribing and managing. Sometimes if symptoms of anxiety or depression are more severe, or the symptom presentation is a little bit more complex, we might recommend talking with a psychiatrist who might have a slightly bigger bag of tricks to help you. And the other thing that I'll just mention about medications is oftentimes, unfortunately, the first time you try it, it might not be effective. And you might have to keep consulting with your doctor to either make changes in the dosage, try a different class of medication. And this is a really important thing, because sometimes patients are prescribed these medications and they're not planning to see that prescribing provider for 6 months or a year. And then they remain on something that might not be helping, and also might have side effects that aren't helpful either. So when you make this decision to kind of try a neuromodulator, just keeping in mind that it oftentimes requires kind of careful follow-up with your doctor to make sure that you're hitting your treatment goals.
Thanks, Dr. Reel. For Dr. Lawton, then how would a patient or a caregiver know the therapy that they're getting right now is the right therapy for them?
So that can be at times challenging to discern. And when we're talking with parents and teens and kids, we often will sort of break it down into green flags, so signs that this is a therapeutic approach that has a strong evidence base, and red flags, which is maybe a therapeutic approach that has less evidence behind it. Your green flag signs, again, that your child or you are working with an approach that has a solid foundation, would be that you've actually discussed the approach, the goals, and the timeline with your therapist. Each of these evidence-based therapies, particularly within the context of IBD, we want those to be really goal-specific. This is not the kind of therapy that we envision goes on for years and years. It's not the kind I often tell kids that, despite what you see on TV, no one is laying on a couch talking about your dreams. These are, really concrete goals. They're skill-building opportunities, which is the second piece. We really want you or your child to be learning new skills. There is absolutely a role for building confidence and self-esteem, but the core of many of these therapeutic approaches are learning skills to manage those big feelings, and to increase functioning and improve mood and affect, and that's all skill building. We'd really want your child or you to have some kind of homework or material that you've learned in therapy, and then you're applying in practice. I spend, 40 minutes, 50 minutes a week with kids, and kids are with their parents, or you're with your partner or spouse for, 5, 6, 7 times that amount of time per day. And so the real work that builds traction is applying what you've done in therapy outside of the therapy space. So you should have homework. You should have a goals that extend from week to week. Number 4, you should feel challenged. So therapy shouldn't feel horrible and uncomfortable, and it shouldn't be suffering. But it should also encourage you to take sort of a step that gets close to outside of your comfort zone, that is where that growth happens. We want kids and teens and adults to feel empowered and equipped, but also to challenge their expectations of what they can do and what they're capable of. If your child is the patient, the parent should be included. That varies based on age. When we're working with teens, we typically have parents take a little bit more of a backseat approach, but we're always including parents in that picture, because Kids, even teenagers, don't exist in a vacuum, and recognizing the role and support and value of the family system and parents is critical. Red flags. So these are signs that you'd want to have some ongoing conversations with your therapist. If there hasn't been any discussion about approach, goals, or timeline, if the session focus or content is sort of hard to describe, if it's more of a tell me about your day, we're always asking about how days are and whatnot, but that shouldn't be the primary focus of the session. If there isn't any expectation to practice anything outside of the visit, if therapy feels easy, or like sort of like a friendship, if it's all sort of sitting in a comfort zone, that typically makes me concerned that we're not really gaining that traction and skill building moving forward. And then finally, if again this is your child that's the patient, if parents are excluded, unless there is a clear reason or rationale, we'd really want to make sure that we were approaching this as a team.
That's fascinating, Dr. Lawton, because you think about the goals and timeline in terms of medical therapy. You and your doctor coming to a point where this is where we want to be, and this is when we want to get there, and this is how we're going to get there. The same thing applies then to mental health treatment.
Completely. Yep. Yeah. I can't imagine what that would feel like to go into a visit with your GI doc, and the GI doc is like, well, okay, like maybe I'll see you again, maybe I won't.
Right.
That precedent should be the same.
Thanks for that. Dr. Reel, what's your advice for patients who are struggling with their emotional health and might need to look for a therapist? How do you recommend that patients find the right therapist, one that specializes in GI symptoms?
Well, we do have a couple of resources, and Dr. Tomasino's done a great job in the Q&A. The Rome GI Foundation, or is it Rome Gastro? I always mess it up. RomeGastroPsych.org.
RomeGIPsych.org.
Thank you. It's right on our right. It's right before us. It's a great resource for similar to Psychology Today. That's a database that you put in some of your identifying information in terms of your location, your insurance, what you're looking for a provider, and it will pull up all of the providers in your area. All that being said, access to GI psychologists is still somewhat limited. And so if there isn't a specified GI psychologist in your area, by going to Psychology Today and looking for a mental health provider who has expertise in health, you can kind of funnel it down and filter the search by health, anxiety management, stress management, chronic pain management, chronic illness. And if you put in those identifiers, it's likely that you're going to find a mental health provider that may be able to help you meet your goals. As Dr. Lawton also talked about the evidence-based therapies, you can search by that too. So you want to look for the providers that are doing evidence-based work, cognitive behavioral therapy, acceptance and commitment-based therapy. And those are going to be people that are equipped, again, to apply their kind of treatment modalities to some of the things that you're looking for in therapy. And when you're reaching out to mental health providers, I think it's important to let them know what you're looking for. So to talk about, maybe I'm struggling with my mental health and how it relates to my new diagnosis of inflammatory bowel disease, or I'm getting ready to make that transition from living at home to going to college. And, there's a lot to navigate there. So there's a lot of different reasons that might take you to therapy. And that being said, therapy doesn't have to be for the rest of your life. So we want to reach goals, and you might come to the point where you're working with your therapist and you've met all the present goals, and you might then not see them for a while, and then maybe later in life something's going on and you might go back to that same person, you might seek somebody else. So I think we keep that in mind too, that this isn't establishing care for the rest of your life. And another resource to consider is a digital therapeutic, and what that can look like. And now most of those products are the research is established in using them for IBS, such as Nerva, which is a gut-directed hypnotherapy app to help with symptoms of irritable bowel syndrome. But I think it would also be very effective and helpful to serve as a coping strategy, to learn relaxation if you're somebody that is experiencing urgency or bowel fluctuations and abdominal pain. While again, the mechanisms by which this type of therapeutic is working for IBS and IBD can be different, it still might serve as a nice resource for you. There are also new and emerging digital products out there, such as something called Trellis Health and Trellis Elevate, that's going to provide you with different resources from a multidisciplinary perspective, all virtually. And so I think the field of gastroenterology is really evolving with the idea that mental health care is so important in the management of IBD. And the researchers are really trying to increase access to appropriate brain gut, we call them behavioral therapies, that kind of encompass all of the therapies that Dr. Lawton talked about. So talk with your gastroenterologist about, the resources that they're familiar with and that they might connect you to. They might have a GI psychologist or mental health provider that they refer to, so they may be able to do some of the legwork from that perspective. And then also consider resources through the Crohn's and Colitis Foundation. They have some wonderful emotional health resources, and they'll certainly be keeping updated on all of the emerging opportunities and support resources available.
Well, thank you. That's some really useful info. And thank you, Dr. Reel and Dr. Lawton, for weighing in on these initial key questions. We hope you all learned a bit more about emotional health. Now we can take some direct questions from our audience. We'd like to welcome Kate Tomasino onto camera. She's been answering questions for us throughout the chat in the Q&A box. We'll direct a few of the audience's questions live to our expert presenters. So if you have a question for Dr. Reel, Dr. Lawton, or Dr. Tomasino, just type it in the Q&A box, which is found at the bottom part of the screen. So let's take our first question. This one is for Dr. Lawton. Could you give some advice specifically for teens who get stressed by school and friendships that set off a flare?
Yeah, how much time do we have? Yeah, I think that just being aware of the relationship between stress with school, whether that's grades or finals or homework or college applications or sports, plus stress related to navigating social relationships, just being aware that how those experiences impact GI symptoms by itself is therapeutic. Being aware that when we're in certain situations at school or with friends, developing that awareness and insight and knowledge about how my body feels when I'm managing these specific worries can be helpful. I think the other piece is setting some real specific priorities and goals so that it doesn't feel like you've got, a million different things that are on your plate. I'll often have kids identify, like, what are the two biggest things in school to focus on and the two biggest things in friendships to focus on. It's not that the other ones don't matter. It's that we're going to put them on the back burner for right now so that we don't have so much going on. The other piece I'll say is that being really intentional about our decisions, whether it relates to classes that we're going to take or opportunities that we're going to jump on, and evaluating, what is necessary and what's sufficient. I think it's, we think of the distinction between being the best and then being like good enough. Sometimes we don't need to be the best. Sometimes good enough is sufficient. Especially if there's a cost. And so the piece that I typically will talk with parents and with teens is like, what is the cost of this? Is it time? Is it social engagement opportunities? Is it your health? And is that cost worthwhile? We really want to help teens feel like they're not only they're autonomous in making some of these decisions about what is a priority and what's not, but then taking responsibility for the decisions that come because of that.
Wow. Well, let's get Dr. Tomasino involved in the conversation on camera here. We had a question in the chat box about managing pain. Are there psychosocial therapies that can help patients manage pain that is definitely a part of Crohn's and ulcerative colitis?
Yes, absolutely. So I know that I would guess Dr. Lawton also does this. I know that Dr. Reel and I both do a lot of gut-directed hypnosis with patients with IBD, which can be an incredibly helpful treatment for patients with IBD who are also suffering from a lot of abdominal pain and other kinds of pain. And then beyond that, cognitive behavioral therapy, which was spoken about earlier, is also really helpful for treating pain and teaching pain management strategies to help reduce and cope with pain. So a trained therapist, just a general like health psychologist or licensed clinical social worker who has experience treating patients with chronic medical conditions should have that as part of their toolbox to work with patients on those things.
Excellent. Again, folks, if you have a question for Dr. Reel or Dr. Lawton or Dr. Tomasino, just put it in the Q&A box at the bottom of your screen. We had another question. This is for Dr. Reel about getting enough sleep when the disease doesn't allow it. Can you get blood work to check certain labs? Additionally, do you have any recommendation or advice on how to get good quality sleep?
Well, so I won't give specifics on which labs to run, but you might consider iron, vitamin D, but there's a whole host of ways that a physician will kind of put together a panel. And so I would want you to talk with your medical provider about those available labs. On the psychological side, they're cognitive behavioral therapy focused on insomnia and that's called CBTI, but we can take different sleep strategies to help patients learn skills to better manage their sleep. Some tangible things that we consider are consistency. So creating structure in terms of what time you get into bed, what that routine looks like, kind of winding down for the day, turning screens down, creating a peaceful kind of bedtime experience, saving bed for sleep and sex. That's it. We shouldn't be eating in bed, doing our homework in bed. We don't want our bed to be our kitchen table. We want to kind of have our brain knowing that when we get into bed, we are going to sleep. And then, certainly for a variety of reasons, prednisone is a big one. That can have a huge impact on our sleep and other medications and symptoms. And so if you're not able to get what we are hoping for, which is nice, restful, restorative sleep, shifting from taking away that expectation and approaching rest. And thinking about lying in bed and resting your body using meditation, relaxation strategies. There are a whole host of digital therapeutics out there that can be downloaded and used for sleep relaxation. Headspace is one of them that comes to mind that has specific kind of sleep modules. And so being prepared to be flexible with the way you're thinking about your rest is important. And maybe if you're flaring and that means that during the day after class or after work, you need to take a little bit of a rest before you complete the rest of your day, if that's available to you, allowing yourself that. But ultimately, if my sleep expert psychologists were with us, they tend to steer you away from daytime naps when you're working on sleep. So if sleep really becomes something that you want more help with, I would again talk to your medical providers about a referral to a sleep clinic to maybe do a medical assessment of your sleep or consult with a sleep psychologist.
And just to follow up, seems like sleep cycles are quite different between, say, little kids, teenagers, young adults. And then as we get older, I know for myself, when I was a teenager, I could sleep 14 hours a night easily, much to the irritation of my parents. And then once I started a career, it was go, 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 go. I could go on 3 hours sleep. And now that I'm retired, I only seem to need, again, like a few hours. But does that vary by age? You look at that in terms of
In a way it can. Um, little ones, they crave structure even though they tell us they don't. So little kid, I have little ones, and my 2-year-old goes to bed at like 6:30, and some people think that's crazy, but she sleeps all the way through the night and can really benefit from 11, 12 hours of sleep sometimes. And so even I think as we age, and I'm not immune to this either. When I was a bit younger, I would, push the boundaries of staying out later and waking up early. However, was that the best thing for my body? Probably not. So even though you can operate on 3 to 5 hours of sleep, ideally, neurologists and sleep psychologists would highlight it's best that you get that 8 hours of good sleep. And so I think that that's something to consider. And certainly as we age, we do tend to then see that, earlier morning wake up, not feeling kind of disruptions in sleep. You're getting up to go to the bathroom sometimes. But I do think that we all benefit from prioritizing good sleep.
Oh, absolutely. Well, this question is for any and all of you, and feel free to weigh in. One of the patients mentioned that it's hard to have a normal social life when your stomach's so unpredictable. What's some advice on how to manage social situations, going out to dinner, parties, and things like that?
I mean, this is what we all do. So you're absolutely right. We probably can tick right down the line in terms of giving some strategies here. So I'll start by saying that anxiety lives in things that are unpredictable and uncontrollable. And so living with a disease that's unpredictable and at times uncontrollable, they go hand in hand. And so, if you're really feeling impacted in terms of how you're navigating social situations, maybe taking a step back and looking at your anxiety management and how are you, do you feel like you've got a toolbox of coping strategies that you can turn to? And also validating that, yes, socializing can look a lot different depending on where your disease activity is. And sometimes you're grieving the fact that something you really looked forward to going to or being at is being impacted by, what's going on in the bathroom that day, or how fatigued you feel. And so having a good outlet to process those emotions is really important.
Yeah, I'll totally agree and echo what Dr. Reel said. I think that, when we're anxious, we tend to be black and white thinkers, that our thinking becomes pretty rigid. And we may find ourselves getting stuck in this idea that, like, I'm either social or I'm not. And the reality is that most of us are going to live in that shade of gray that can be hard to see in the moments when we're more stressed or when we're more anxious. But intentionally sitting there and saying, okay, well, what are actually the different ways that I can be social? What are the degrees? Maybe I can't go out, but maybe my friends could come in. Maybe I can't commit to every weekend having an activity, but maybe I can prioritize 2 weekends. Maybe I can agree to go out in the morning when I feel better instead of the afternoon, or I can agree to go to this restaurant and this restaurant because I know where the bathrooms are. I think intentionally asking, like, are there actually other options? And intentionally trying to problem solve in ways that recognize that, like, it doesn't have to be so black and white, can be one of the strategies that feels helpful, because usually there's an in-between that's a good option.
Mm-hmm. Dr.
I love how
Thomasino, you gonna weigh in?
I'm just going to add, I love how you describe, both of you described that and the role of anxiety and just getting as flexible as you can in thinking about socializing, and then planning as much as you can as well. So if it's something that's very important to you and you are flaring, there are ways that you can help yourself feel a little bit more reassured that if there is, like if a flare to you includes things like potential incontinence, what can you do if that occurs? How could you manage that? For some people who come in to see me, they can't imagine managing that. And other people who come in to see me, they've been managing that daily for years in public settings. And so there's this really wide spectrum of how we're thinking about how to approach a social situation based on our symptoms. So I just wanted to add that into just kind of planning and being prepared, I think can help you get through some of those social situations that are really important to you.
And, you
Well,
know, as a veteran support group person, I've found that they're a wonderful place for a person who's either newly diagnosed or been diagnosed 25 years ago to come and open up a little bit, because now you're in a room not with people who don't understand anything about what's wrong with you, but you're in a room with people who are exactly like you, in the same, you're all in the same boat. And that opens the door to feeling like you can start to talk to other people. Am I on the right track here?
Absolutely. That social connection of knowing that, you know, maybe the person that just shared has experienced something way worse than what you've, you know, even dreamed of having, and that they've lived to tell about it. And I somewhat jokingly share this with patients that oftentimes there is anxiety about uncomfortable or embarrassing potential things, or maybe something has happened. Maybe you've had a bowel accident. Maybe you've passed gas in public. Maybe, you know, you've needed a bathroom so bad that, you know, you had to pull over on the side of the road. And part of this is resilience. And resilience is being able to face whatever it is before you and coming out on the other side. And there's actually really interesting research that shows that, number one, you can harness and build resilience. So if you feel like you're not very resilient, you can become more resilient, but that patients that have IBD that are more resilient have better healthcare outcomes. They are more capable of managing the many things that come along with IBD. So being in a room that going back to kind of the social support and support groups, I think sometimes just being inspired by other people around you gives you that confidence that, you know, I can too do it. And also if something doesn't go as well as you wanted, you can come back to your support group and kind of talk it through and feel, you know, that you're not alone in that.
Oh, great. That's excellent. We have another question for Dr. Tomasino. One of our attendees asks, is there a particular resource you recommend that I can share with loved ones that explains what a patient may go through physically and emotionally and how that all kind of connects?
So I'm not sure how much or how well this this person has looked at the Crohn's and Colitis Foundation website, but there are a lot of actual patient testimonies there. So that might be something. I read that question in the Q&A and I didn't answer it because I think they said something succinct, something that just tells the story in a couple of sentences. And you know, I think a resource would be going to the Crohn's and Colitis website. I haven't found a better resource for explaining the patient's experience of having Crohn's and colitis. I would also say that if taking some time to practice what one wants to share in different settings and situations, you know, depending on what degree of the relationship. Is this a partner? Is this a parent? Is this a friend who's a loved one? And getting familiar with that language, kind of practicing it, writing it out actually can be really helpful too. So if you want to be your own resource telling your story, in addition to sharing other people's experiences, I think that can be really helpful. In therapy, often we have people learn how to communicate about their condition with other people and almost have like an elevator pitch that can vary across different relationships. So that is what I would say. I'm sure that Dr. Lawton and Dr. Reel have other resources they can share too.
That would be great.
You Google University of Michigan IBD school. Through a series of grants and over the last several years, we've created there's probably, I was just looking to make sure it's still up and going, but we have IBD School 100 through I think all the way up to 800 series. And they're very short videos that are done by IBD physicians, GI dietitians, psychologists, pelvic floor physical therapists, and they're all describing different aspects of disease management. And over the years, I've had patients that they'll say, you know, I picked 5 videos and I sent them to, you know, my grandma because she keeps sending me a banana diet that has been known to cure inflammatory bowel disease. And I can't tell her anymore that's not the right thing. And so I hope that you find these to be valuable resources to share with friends and family. And also, I think it's helpful. I've had lots of patients that have found it helpful to learn more about something, an aspect of their own diagnosis and disease management. So IBD School.
Perfect answer.
Thank
Just what
you
we were
for
looking
that.
for.
Yeah, I've looked at a few of those videos and it's marvelous. But some people, a lot of people say to me, they're just not understood either by their parents, their children, their partner, their boss. It's a conversation that's so difficult to have. And some people are very uncomfortable talking about, you know, bowels, just the word itself. Is there any kind of icebreaker, maybe humor or something like that?
So I think, Eugene, you're sort of hitting the nail on the head, that these are hard conversations. And at the same time, the more comfortable we are, and we can sometimes fake that comfort if you're not totally there yet, but the more comfortable we are, the more comfortable others will be as well. And so I typically actually steer families and kids away from using sort of more easier, more comfy, or more cozy words. If we're talking about poop, we're talking about poop. That we're going to say the words, because the more secrecy, the more sort of hidden meanings that we give them, that builds stigma, right? And so if we're going to talk about these hard things, we're going to do it in a way that's really open and candid and transparent to try to reduce some of that stigma and secrecy and shame around it. The other thing that I often will talk to especially teens about is really reminding them that they're in the driver's seat. That, again, this isn't I either am sharing or I'm not sharing. That we can sort of think of ourselves as a sieve, right? Where we have tiny, tiny holes and we let a little bit of information through, versus a colander, which has big holes and we let a lot of information through. That we want kids to feel as if they could control the messaging and the amount of details depending on the circumstances, and giving them the ownership to that. I think there's often an expectation that we owe people an explanation, and we don't. Sometimes it's helpful, but sharing and confiding and explaining should be something that the patient owns. And that's their story, their narrative. And if they choose to share it, awesome. But that's, again, their choice. I think giving permission also to disengage from relationships that feel challenging on the communication end, that, again, you don't owe your story to anyone. And even if grandma continues to send that banana recipe, we can try to correct it. And if this is not the right time or place to do that, that's okay too.
Yeah.
Such good advice for just relationship building, right? And so that's, you know, as we go through the lifespan, right, we're just learning how to develop healthy relationships with our peers, and then intimate relationships and dating and dealing with a boss. And, you know, ideally in a healthy relationship, the first time you meet somebody, you're not bearing your entire soul. You're not sharing everything about yourself. You're not just somebody that has IBD. There's a whole lot about you. And so I think that when it comes to the people that might not be very supportive of your health, whether it be physical, emotional, or your interests, then they're giving you information about them that you can use to kind of recognize. Maybe, I give that person, if it's a boss and you like your job and you plan to work, you give them the bare minimum information that they need in order to meet your need of getting a paycheck. But if this is happening with somebody that you're in more of an intimate relationship, it might be a bit red flag that, look wider before you get into that relationship further.
Yeah. Yeah. Well, we have time for one more question. I guess this one's for Dr. Lawton from our audience. So you mentioned CBT as a therapy, and hopefully people are not confusing that with CBD, but could you explain cognitive behavioral therapy a little bit more?
Yeah, so definitely not CBD, CBT, cognitive, so fancy word for what we're thinking, behavioral, our actions, and therapy, T. CBT capitalizes on that relationship between the thoughts that we have, our actions and behaviors, and the way our body feels. We know that we can't just snap our fingers and make stress, anxiety, depression go away. Because if we did, Dr. Reel and Dr. Tomasino and I wouldn't have jobs, right? Because no one wants to feel this way. But it turns out that when we can become more aware of our thoughts, we can't necessarily change them, but we can become aware of them. And when they're accurate or inaccurate, when we start to take control on how our body feels and make intentional decisions about using strategies to shift how we're feeling, whether that's through relaxation strategies or things like adjusting sleep, eating, and then behaviors, meaning maybe I will go to that party with my friends that I've been avoiding because I'm worried about it. I'm worried about my IBD there. When we shift those things, which we do have control over, we're actually able to start decreasing anxiety, whether that's IBD related or not, and improve our mood. Again, IBD related and otherwise. And we do that through really working with that triangle model, that tripartite system.
Well, thank you all. Dr. Megan Reel, Dr. Rachel Lawton, and Dr. Kate Tomasino. This was a really good discussion. We learned some helpful information today. So as our program comes to a close, on behalf of the Crohn's and Colitis Foundation, we encourage you to keep learning about IBD and visit some of the helpful educational resources on your screen. To watch previous webinars and expert conversations in the series, please visit crohnscolitisfoundation.org/myibdlearning. Also want to remind everyone to please fill out an evaluation survey that'll be sent to you after tonight's program. We really do appreciate the feedback, and this helps us plan future programming. So thank you for joining My IBD Learning virtual program, IBD and Your Emotional Health. Have a great rest of your evening.